Okay, so redressing your toe after you've had nail surgery. Now, you will be given all the things that you need in your pack, and what you'll need to do is you're going to redress it twice a week and twice a week only, and you need to have your bath or shower before and let that dressing get wet. Now, your hands should already be clean, but if for any instance they're not, make sure they are before you start handling any of your dressing materials. So, you have a dry dressing here. You also have some tape, so you want to cut off a thicker piece and then a thin strip from the tape that you're provided with, and you also have some tube gauze. Now that needs to be 3 times the length of your big toe, but you can use your thumb as a reasonable guide also. So with that tube gauze, you're going to pop it onto your tube gauze applicator. Now yours will be a white plasticky one rather than a metal one, but it's exactly the same. So you put it down on the bendy end and just work it down the length of it there and put that to one side. So with your dry dressing there, it's shiny on both sides, which is a non-stick, so it doesn't really matter which side which side you put to the toe at all. Open up the pack to that, and then you're going to take your thin strip and you are going to just stick that thin strip to the dry dressing. It takes me ages. Not usually, but it does for video purposes. There we go. So pop that onto your dry dressing and keep him ready. There we go. So he's all stuck there. I don't advise you go waving it around. That's just for the video purposes. Then you're going to get your tape and you're going to fold your thick piece in half. Now at this point you can just round off the corners. You don't have to do any funky cutting, but if you fancy having a try at your Blue Peter skills, you can try and cut it into this shape, which does help it bend around your toe a little bit better. I usually do give you the backing of the piece that I use for your first redressing to take home with you, and you can use that as a template, or you can just go freestyle and try your own. So once you've got that, you unfold it and there you go, your tape all ready. So you've had your bath or shower and your toe is nice and wet. So when you get out and you take the dressing off, you're going to dry that off with a bit of kitchen roll, something like that. And you're not messing with the business end of things at all, you're just drying it off. If you find it's very dischargy, you're going to put a bit of Vaseline on that good skin. When you've done that, you've got your dressing with the tape on and you're just going to stick that to your toe. Now you're not doing this with any, so it's not tight at all. It's literally just holding it in place while you do everything. See, it's nice and loose there. You don't want any excessive pressure on it whatsoever. The easier you go on it, the quicker it will heal. So you're then going to take your tube gauze on the applicator and you're going to pop it over the toe. So you're going to slide that over the toe, making sure there's no creases in your dressing. And then you're going to pull the base of the tube gauze down to the base of your toe. And you want to make sure that there aren't any great rolls of it or any rucks or what have you, because that can rub in between. So make sure it's just down as far as it needs to go. When that's got that right, you're going to pull the applicator up and you're going to turn it about half a turn so that you can't see your toe peeking through the top. So you want it so you can't see your toe peeking through the top, but not so much that you've got a great big nut on. And then when you've got that, you're going to pull it back down over itself, again making sure that you don't have any rucks or anything like that. Now the discharge will be all colours, be reds, pinks, browns, yellowies, but it'll be quite thin. That's all okay. That's exactly what we expect it to be. And there's lots of good stuff within that discharge, which will help the healing. So please don't be tempted to change your dressing more than the twice a week, as we've stated. Now, when you get 2 dressings in a row that are as clean and as dry as the day you put them on, you can stop dressing it. The scabs will be there and you can just treat it like a normal toe, and then they'll just drop off in their own sweet time. Now, if it gets infected, that discharge will change. It'll go to a quite thick, yellowy, typical pus. Your toe will be red, hot, throbby, painful. They're all signs of infection, so you may well need antibiotics, or certainly get in touch with us if you experience any of those problems. As you can see, I've just put the tape around there, so just make sure it's really adhered and everything's okay. So on the days that you're not due to change it and you need to have a bath or shower, pop one of those gloves over it, and that will just help to keep it dry while you're in the shower. Remember, if you're not sure about anything, refer to your leaflet or give us a call.